In the early 2000s, a seismic shift occurred in women's healthcare that left millions grappling with confusion, fear, and deteriorating quality of life. The controversy surrounding hormone replacement therapy, HRT, became one of the most polarizing debates in modern medicine, exposing deep flaws in how scientific research is communicated to the public and implemented in clinical practice. What began as a groundbreaking study aimed at understanding chronic disease prevention among postmenopausal women spiraled into a nationwide panic, leading to the abrupt withdrawal of HRT prescriptions. This decision had far-reaching consequences for countless women who relied on these treatments not just for symptom relief but for their overall health and well-being. At the heart of this upheaval was the Women's Health Initiative, WHI, an ambitious and costly research project designed to investigate whether hormone replacement therapy could prevent chronic diseases such as heart disease, osteoporosis, and cancer. Launched in the early 1990s, the WHI enrolled over 160,000 participants, making it one of the largest studies of its kind. However, while its goals were noble, the execution and interpretation of its findings would ultimately sow discord within the medical community and leave patients feeling betrayed by the very system meant to protect them. The study focused primarily on older women, with an average participant age of 63. This demographic represented a decade past the typical onset of menopause, yet it formed the basis of sweeping conclusions about the safety and efficacy of HRT for all women. Critics argue that this skewed sample undermined the relevance of the results for younger women experiencing acute symptoms of estrogen deficiency. For many women under 60 or within 10 years of menopause, HRT had long been praised as a lifeline. It alleviated debilitating hot flashes, restored sleep patterns, stabilized mood swings, and even improved cognitive function. Beyond symptom management, HRT offered protective benefits against conditions like osteoporosis, cardiovascular disease, and dementia, ailments closely linked to the natural decline of estrogen levels after menopause. When the initial findings from the WHI were released in 2002, they sent shockwaves through both the medical establishment and the general public. Headlines blared warnings about increased risks of breast cancer, stroke, and heart disease associated with hormone replacement therapy. These alarming claims dominated news cycles, overshadowing the nuanced data buried within the study itself. The messaging was black and white: hormones cause harm. Doctors across the country stopped prescribing HRT almost overnight, leaving patients scrambling to cope without access to a treatment that had transformed their lives. Behind closed doors, however, skepticism lingered. Many healthcare providers questioned the validity of applying the WHI's conclusions to younger women who stood to benefit most from HRT. They pointed out that the reported risks were based on relative risk rather than absolute risk, a critical distinction often lost in media coverage. Relative risk measures the proportional increase in likelihood compared to a baseline, while absolute risk reflects the actual probability of harm. In this case, the absolute risk of adverse outcomes attributed to HRT was less than 1%. A figure unlikely to alarm most informed patients weighing the pros and cons of treatment. Furthermore, much of the elevated risk observed in the study stemmed from older participants who already exhibited signs of pre-existing vascular damage, such as arterial plaque buildup. Younger women, particularly those within a decade of menopause, showed no such correlation and instead experienced reductions in coronary artery disease and overall mortality rates when using HRT. Despite these caveats, the narrative took hold, fueled by sensationalized reporting and fear of litigation. physicians found themselves caught between evidence-based medicine and the specter of malpractice lawsuits. Emergency meetings were convened to address patient concerns, pharmacists struggled to keep up with prescription cancellations, and women faced an impossible choice: abandon a therapy that had restored their vitality or defy medical advice and continue taking hormones against all odds. Some discarded their medications immediately upon reading the headlines. Others stockpiled pills, determined to maintain control over their bodies despite the mounting pressure to stop. The fallout extended beyond individual suffering. As estrogen levels plummet during menopause, the body undergoes profound changes that can have lasting implications if left unaddressed. Estrogen plays a crucial role in maintaining bone density, regulating cholesterol levels, supporting brain health, and preserving cardiovascular integrity. Its absence increases susceptibility to fractures, heart attacks, strokes, and neurodegenerative disorders. Without adequate intervention, many women faced accelerated aging processes and diminished quality of life. For some, the consequences were catastrophic. Stories emerged of seemingly healthy individuals sustaining spontaneous fractures due to severe osteoporosis, a stark reminder of the silent toll exacted by estrogen deprivation. Perhaps most troubling was the disconnect between what scientists knew and what the public understood. Key investigators involved in the WHI later revealed that they had little input in shaping the messaging conveyed to the press and public. Instead, leaders at the National Institute of Health controlled the dissemination of information, opting for dramatic soundbites over careful explanation. This top-down approach prioritized simplicity over accuracy, resulting in widespread misunderstanding. By failing to differentiate between subgroups within the study population or contextualize the magnitude of reported risks, officials inadvertently perpetuated misinformation that continues to influence attitudes toward HRT today. Decades later, the legacy of the HRT controversy remains fraught with complexity. While subsequent analyses have sought to rectify misconceptions, rebuilding trust has proven challenging. Advocacy groups have emerged to champion the rights of women seeking personalized care tailored to their unique needs and circumstances. Researchers continue to explore alternative therapies and refine guidelines to ensure safe and effective use of HRT for those who stand to benefit most. Yet lingering doubts persist, underscoring the importance of transparent communication and shared decision-making in healthcare. Looking ahead, lessons learned from this episode must inform future efforts to translate scientific discoveries into practical applications. Policymakers, clinicians, and journalists share a collective responsibility to present findings accurately and responsibly, avoiding sensationalism that can erode public confidence. Patients, too, deserve access to comprehensive information that empowers them to make informed choices about their health. Only through collaboration and open dialogue can society hope to avoid repeating the mistakes of the past and pave the way for a more equitable and compassionate approach to women's healthcare. As awareness grows around the intricacies of hormonal health, there is renewed optimism that science will once again embrace the potential of hormone replacement therapy, not as a panacea but as a valuable tool in the broader arsenal of treatments available to women navigating the challenges of menopause and beyond. With greater emphasis on individualized care and ongoing research, the medical community stands poised to reclaim HRT as a cornerstone of preventive medicine, restoring dignity and vitality to millions whose voices were silenced in the wake of misguided policies. This chapter in medical history serves as a sobering reminder of the power dynamics at play in shaping public perception and policy. It highlights the urgent need for accountability, transparency, and empathy in addressing the diverse and evolving needs of women throughout their lifespan. Though scars remain from the events of 2 decades ago, they also offer fertile ground for reflection and growth, a testament to resilience amid adversity and a call to action for a brighter, more inclusive future. As we wrap up this discussion, it's clear that the story of hormone replacement therapy is far more complex than the headlines once suggested. This isn't just about science, it's about trust, communication, and ensuring that women have access to accurate information so they can make the best decisions for their health. If you've been impacted by this topic or know someone who has, I encourage you to share your thoughts in the comments below. Did this video help clarify any questions you had? Are there other aspects of HRT you'd like explored further? If you found this video insightful, please give it a thumbs up and subscribe to the channel for more content like this. Sharing this with others can help spread awareness and spark meaningful discussions about women's health. Together, we can advocate for better understanding and more personalized care. Thanks for watching.